Hey there, Dr. Todd Cameron here, GP. The purpose of this short video is to discuss the groups that are included in the federal government funded 2021 flu vaccine immunisation program. So this document is from the Australian government and it is so-called ATAGI, Australian Technical Advisory Group on Immunisations. What I want to do now is go to two things. First thing is the timing of the vaccination. In previous years, you may have heard certain peak bodies say that we would prefer that people have the vaccine later in the year because its peak efficacy is around 3 to 4 months and the flu season is usually June to September or thereabouts. The current advice is if you're in 1B for the COVID vaccination, which means you're receiving it through general practice, then it's important that you get the flu vaccine as early as possible in the year. And we won't go too much into the reasons why, but that's the current recommendation. Now I'm going to walk you through who is covered under the government supply of vaccines, which means there is no cost to the patient for that. And so the key groups are for children aged 6 months to 5 years. That's the first group. Adults that are 65 and above are covered irrespective of anything else. So if you wish to receive vaccination, there won't be a charge for the vaccination itself, for the immunisation. And the other groups are Aboriginal and Torres Strait Islanders of any age, and pregnant women at any stage of pregnancy are recommended to receive the vaccine. Now, the specific medical conditions I'm going to walk through, and if there's any lack of clarity here, just have a conversation with your GP and they'll be able to tell you which group you fall into. Of course, if you don't fall into any of these groups and you would like the flu vaccine, that's fine. Just have a chat to your general practice about a private flu vaccine, and that's pretty easy to organise as well. Relatively inexpensive and certainly a lot less than a day off work. So cardiac disease means heart disease, congenital heart disease as people are born with, heart failure and coronary artery disease, blockage of the arteries, etc. Chronic respiratory conditions, chronic lung conditions, so severe asthma and having chronic obstructive lung disease would be the main things here. So again, have a chat with your GP if you're not sure. Chronic neurological conditions, so long-term nerve-related problems, make sure you have a chat to your GP because there could be quite a few conditions covered underneath that. Immunocompromising conditions, so this means where your immune system is not doing the proper job because you've had your spleen removed or other conditions such as HIV infection. Again, have a chat to your GP about that. Diabetes type 1 and 2, and there are some other more rare metabolic disorders. Again, have a chat to your GP about that. Kidney disease, chronic renal failure, important to have a conversation with your GP to determine if that's relevant for you. And long-term aspirin therapy in children aged 6 months to 10 years. If you're in those groups and you know you're in those groups and you're definitely funded for the government supplied influenza vaccine. If you're not in those groups, that's fine. Just chat to your general practice about a private vaccine and let's get going. We've got a lot to do this year, so it's important we get organised and get immunised as soon as possible. Cheers.